Dum 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 dum.
Doc, I'm feeling terrible. I've had a high fever for 3 days. I was doing great, and then all of a sudden I was sick. I'm very short of breath, and I'm coughing up pinkish red stuff. My chest is killing me on the left side. I'm definitely getting worse. Doc, I can't take much more of this. Please help me.
You are now inside the patient's left lung. To cure this patient, you need to find all 10 of the bacteria and zap them. Remember that she has had a fever and a cough for several days. Avoid damaging healthy cells. Well done, doctor. You have cured the patient of pneumococcal pneumonia. Pneumonia is caused by an infection of the lungs. Of the many pathogens that can infect the lungs, the most common is the bacterium Streptococcus pneumoniae, or the pneumococcus. Pneumococcal infection is generally confined to a single lobe of the lung, an illness referred to as lobar pneumonia. When lobar pneumonia occurs, most of the small air spaces within the infected lung lobe fill up with water and pus. This illness is diagnosed readily from the history and physical exam, along with the chest X-ray, which shows opacification of the affected lung lobe. Fortunately, the pneumococcus is relatively sensitive to antibiotics, and the prognosis is good for patients that are properly treated. Of note, the patient's clinical status will improve long before the chest X-ray will return to normal. The patient will generally feel much better after only a few days of antibiotic therapy, while a couple of months are required before the affected lung lobe appears completely healed on the chest X-ray. Dum 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 dum.
Doctor, I was bitten by a crazy dog yesterday, and I'm really scared. The bite hurts a lot. I wasn't even doing anything to the dog. My mom is worried that I might get rabies. She said you were going to stick me in the stomach with a bunch of really big needles. Can I leave now?
You have been transported into the patient's brain. To cure this patient, you need to find all 10 of the viruses and zap them. Remember that he was bitten by a mad dog just yesterday. Avoid damaging healthy cells as it will cost you valuable time. Congratulations! You have cured the patient of a rabies virus infection. Rabies is a viral infection of the nervous system. The virus is transmitted to humans by rabid animal bites. Many cases are the result of dog bites. Raccoons and bats are other common carriers. Worldwide, there are an estimated 15,000 cases of rabies each year. There are very few cases in the U.S., however, largely as a result of intensive efforts to vaccinate dogs. Untreated cases are usually fatal. Treatment is given to patients when there is reasonable suspicion of rabies exposure following an animal bite. The primary treatment involves a several-week course of anti-rabies antibody shots. The treatment works by enabling the body to eliminate all the rabies viruses before the disease develops. Fortunately, the medicine has changed and it is no longer administered through the stomach.
Ow! Oh, that hurts. Don't poke me in the belly like that. Oh, my stomach's been hurting since yesterday morning. I vomited twice yesterday and now I have diarrhea. Today I even collapsed at work because I felt so lightheaded. Doc, please help me. I'm feeling really sick.
You have been transported into the patient's stomach. To cure this patient, you must find all 10 of the viruses and eliminate them. Remember that she has been suffering from nausea and vomiting for 2 days. Fantastic work, Doctor. You have cured the patient of viral gastroenteritis. Gastroenteritis is a common cause of abdominal pain and vomiting. It is caused by any of a large number of different viruses or bacteria that a person may be exposed to by consuming contaminated food or water. This case of gastroenteritis was caused by a rotavirus infection. Symptoms can vary from mild to very severe. Generally, gastroenteritis lasts only a few days and resolves without any problems. Treatment depends mostly on replacing lost fluids. It's time to see another patient. Doc, this is the worst pain I've ever felt. My chest feels so heavy and my left shoulder is aching. I can barely breathe. I tried my nitroglycerin pills, but they didn't help at all. My father had a heart attack when he was my age. I think this is the same thing. I'm so worried. You have been transported into the patient's heart. To help this patient, you must find all 10 of the cholesterol plaques and eliminate them. Remember that he is suffering from severe pain in his chest and left shoulder. Hurry! Every second is critical. Excellent job. The patient will recover from his heart attack thanks to you. Complete blockage of a coronary artery cuts off the oxygen supply to part of the heart muscle. If this blockage persists long enough for part of the heart muscle to die, it is myocardial infarction. Diagnosis of a heart attack requires any two of the following 3 things. 1. A history suggestive of a heart attack. 2. A significant rise in the blood level of CPKMB. CPKMB is an enzyme found only in heart muscle cells that is released into the blood when the heart muscle cells die. And 3. EKG changes characteristic of a heart attack. Recently, it has been shown that treatment of heart attack victims with blood thinners can improve the odds for recovery. These blood thinners, or thrombolytics, work by dissolving blood clots and thus reopening blocked coronary arteries. Emergency balloon angioplasty can also be used early on to try to open up blocked coronary arteries. Mm-hmm.
2 years ago, I had an ugly black bump removed from my back. I didn't want to go see the doctor, but when it started to bleed, I knew I had to do something. The bump turned out to be a melanoma that was quite deep when they removed it. Now I'm having pain in my chest, and I'm very scared.
You are now inside the patient's left lung. To help this patient, you must find her tumor and destroy it. Remember that she has a history of malignant melanoma. Incredible work! The patient is doing better since you removed the melanoma metastasis from her lung. Malignant melanoma is the most serious form of skin cancer. It is most common in fair-skinned people who have been overexposed to the sun. Severe sunburns as a child are a notable risk factor for later development of malignant melanoma. Melanomas typically develop on parts of the body which receive significant sun exposure, such as the arms or the back. Malignant melanomas have several distinguishing features that one should be aware of. They typically appear as dark bumps with irregular borders and/or irregular elevations. They tend to have variegated colors, including shades of red, blue, and black. They may even begin to bleed spontaneously or ulcerate. Treatment for melanoma depends largely on surgical excision of the skin cancer. Once it spreads, it becomes much more difficult to treat. Early detection and treatment are thus the key to cure the disease. The incidence of melanoma continues to rise in the U.S., almost certainly due to the popularity of sun tanning in our culture. If you must be out in the sun, it is wise to use sunscreen, which protects the skin from the harmful and aging effects of the sun's ultraviolet rays.
Doc, I've been feeling out of breath for the past few days. I'm also having problems with my right leg. The calf is red and swollen, and it hurts to walk on it. This happened to me once before when I had an operation. Back then, my doctor put me on blood thinners, and I got better.
You have been transported into the patient's heart. To cure this patient, you need to open up a blocked vein. Remember that she has been complaining of shortness of breath and pain in her right leg for several days. Excellent! You have cured the patient of a pulmonary embolism. Pulmonary emboli typically occur when blood clots form within the large veins of the legs and then break loose. These blood clots then travel through the right side of the heart before lodging in the pulmonary veins. Once lodged in a pulmonary vein, a blood clot cuts off the supply of blood to a wedge-shaped segment of the lung served by that pulmonary vein. The affected lung segment rarely dies, however, because it also receives oxygenated blood from the bronchial arterial system. Nonetheless, pulmonary embolism is a serious illness that usually causes shortness of breath and chest pain. Diagnosis is most often made on the basis of the ventilation perfusion scan, which shows the segment or segments that are not receiving blood because they are blocked. Treatment is dependent on blood thinners, which prevent new clots from forming, while allowing the body's natural mechanisms to dissolve the existing clot. The main risk factors for the development of pulmonary emboli are a history of inactivity, such as that caused by recovery from an operation, and a previous history of pulmonary emboli.
Doctor, I have been losing weight for a few months, and I have been having sweats at night. My belly has also been hurting for a long time, but it has gotten much worse recently. Yesterday, someone at work told me that the side of my neck looks swollen. Something must be wrong.
You are now inside the patient's heart. To help this patient, you need to find her tumor and eliminate it. Remember that she has been suffering from severe abdominal pain for several weeks. Very well done. The patient is doing better since you removed the lymphoma from her abdomen. Lymphoid tissue cancer is called lymphoma. This is a diverse group of cancers whose prognosis varies widely. Most typically, patients will present with one or more painless enlarged lymph nodes, along with symptoms of chronic illness such as protracted weight loss. Because lymph nodes are present throughout the body, lymphoma can involve nearly any organ. In this case, the major site of involvement was the left upper quadrant of the abdomen and the spleen. Lymphomatous masses are sometimes removed when symptoms justify surgical intervention. More typically, however, treatment depends on either radiation therapy, chemotherapy, or both.
Doc, I was walking in the living room about an hour ago when I just fell down. Now I can't even move my left arm or leg. The whole side of my body feels numb. Something like this happened to me once before, but it went away after a few minutes. This time I'm not getting any better. Please help me.
You are now inside the patient's heart. To help this patient, you need to go exploring and open up a blocked artery. Remember that he is suffering from sudden paralysis of the left side of his body. Move quickly. Every second makes a difference. Amazing job! The patient will recover from his stroke thanks to you. A stroke occurs when the blood supply to part of the brain is interrupted for long enough to cause damage to the brain. Blockage of the arteries supplying the brain is the most common cause of stroke. Emboli often form at sites of cholesterol plaque buildup within the carotid or neck arteries. The emboli can then break off and travel upwards to the brain, thus causing a stroke or infarct. A head CT is usually performed to make sure that the patient's symptoms are indeed attributable to a stroke and not to some other cause, such as a brain tumor. The location of the infarct can be reasoned from the symptoms that the patient describes. The nerve fibers that control motor function and sensation cross over to the opposite side of the body. In this case, it is clear that the stroke must be on the right side of the brain, since the patient complained of weakness and numbness only on the left side of his body. Most likely, the stroke will turn out to be in the right internal capsule, a place in the brain where the nerve fibers for both the left upper and left lower extremities are close enough to each other to be affected together. Recovery from strokes is quite variable. Sometimes much of the initial dysfunction is due to swelling within the brain rather than cell death, and in some cases, recovery of brain function is nearly complete.
Doctor, I feel like the hearing is going in my right ear. At first I thought it was my imagination, but lately my right ear has been ringing. Otherwise I feel great. Do you think I'm crazy for coming to the emergency room? Maybe I shouldn't have come in, but I'm worried since the ringing won't go away.
You have been transported into the patient's heart. To cure this patient, you need to find her tumor and eliminate it. Remember that she has been suffering from progressive loss of hearing and ringing in her right ear. Awesome work, Doctor! You have successfully removed the patient's brain tumor. This patient had an acoustic neuroma, a benign brain tumor that arises from the Schwann cells that surround the 8th cranial nerve. The 8th cranial nerve is responsible for hearing and balance, which explains why the patient had symptoms of hearing loss and ringing, or tinnitus, in her ear. Acoustic neuromas account for about 5% of all primary brain tumors, that is, tumors that start in the brain rather than metastasizing from somewhere else. As they grow, acoustic neuromas can cause deafness as well as other symptoms, such as facial pain, double vision, and facial weakness, by compressing first the 8th cranial nerve and then the 5th, 6th, and 7th cranial nerves. Treatment depends on surgical excision. The prognosis is generally good.
Doc, this morning I had a sore throat, and then all of a sudden I got really sick. I have a terrible headache, the worst I've ever had. I can barely move my head because my neck hurts so much. I vomited twice today and I have a fever. This is happening so fast. Please do something for me.
You have been transported to the patient's heart. To cure this patient, you need to find all 10 of the bacteria and eliminate them. Remember that he has had a high fever, a stiff neck, and severe headaches for the last 12 hours. Avoid zapping healthy cells. Hurry! Time is of the essence.
Oh no! Use it!
Oh no! Great job, Doctor! You have cured the patient of bacterial meningitis. Meningitis is caused by inflammation of the membranes, or meninges, which surround the brain and spinal cord. Many organisms can cause meningitis, including bacteria, viruses, and fungi. These organisms usually reach the meninges through the bloodstream after first starting the infection somewhere else in the body. Bacterial meningitis is a rapidly progressive, life-threatening illness. It is diagnosed on the basis of the history, physical exam, and the results of the lumbar puncture. The lumbar puncture is done to obtain some of the fluid that is contained with the meninges. When meningitis is present, this fluid will be cloudy because of the presence of white blood cells and bacteria. Antibiotic therapy must be initiated as soon as possible. When treated promptly, the outlook for full recovery is quite good.
Hello, Doctor. My back and my right arm are hurting. I fell off a stepladder this morning, and I landed on a tile floor. I don't think anything is broken, but I wanted to get it checked out. Have you seen my x-rays? Not yet? Do you mind if I step outside for a cigarette while you look at them?
You have been transported into the patient's left lung. To cure this patient, you need to find her tumor and eliminate it. Remember that she is a long-time smoker. Well done! You have cured the patient of lung cancer by removing it before it could spread. Typically, lung cancer isn't diagnosed until symptoms appear, such as a worsening cough or chest pain. By this time, the cancer has usually spread and the prognosis is poor. Sometimes, however, lung cancer is detected on a routine chest X-ray performed for some other reason, as in this case. When detected early, lung cancer can often be removed surgically with a good chance for complete cure. Lung cancer is the leading cause of cancer deaths in both men and women in the U.S., and cigarette smoking is the main cause of lung cancer. The incidence of lung cancer is strongly related to the amount of smoke a person is exposed to. Quitting the smoking habit is the best thing a person can do to minimize their risk of developing lung cancer.
Doc, I haven't been able to go to school for more than a week. My stomach hurts the most, but I also have a headache and I can't seem to eat anything. I think I've been running a temperature, but we don't have a thermometer in the house. Whew, I feel nauseated. Oh no, I think I'm going to throw up.
You are now inside the patient's right lung. To cure this patient, you need to find all 10 of the bacteria and zap them. Remember that he has had fever and abdominal pain for more than a week. work! You have cured the patient of typhoid fever. Typhoid fever is caused by eating either food or water contaminated by the bacterium Salmonella typhosa. The infection is spread from person to person through feces, usually by contamination of water supplies with sewage. Infection can also be spread through the handling of food by typhoid carriers. The bacteria pass initially from the intestine into the blood, and then to the liver and spleen, where they multiply. Next, they are secreted by the liver and concentrated by the gallbladder. At this point, the bacteria are released once again into the intestine, but now in enormous quantities. The most worrisome complications are significant intestinal bleeding and/or intestinal perforation. Diagnosis is confirmed by culturing the bacteria from the blood, feces, or urine of an infected patient. Treatment is dependent on antibiotic therapy. It is not uncommon to recover from the illness without serious incident, but to remain a carrier for many years with the organism sheltered within the gallbladder. Doc, I've been feeling terrible for 3 days now. I can hardly move. I've never been this sick before. I have a high fever and I'm having a hard time breathing. I keep coughing and coughing, but hardly anything ever comes up. I feel like I'm going to drop dead. Please help me. You have been transported into the patient's stomach. To cure this patient, you need to find all 20 of the viruses and zap them. Remember that he has been suffering from fever, cough, and shortness of breath for several days. Amazing job! You have cured the patient of influenza pneumonia. The flu virus typically causes a relatively mild upper respiratory illness that lasts anywhere from 3 to 7 days. Rarely, however, the influenza virus can infect the lungs themselves, causing a very severe form of pneumonia that can be fatal even in young, healthy adults. Although there is no specific therapy for this viral illness, it is difficult to distinguish influenza virus pneumonia from the more commonly seen bacterial pneumonias. This patient would thus have been treated with antibiotics as if he had a bacterial pneumonia such as pneumococcal pneumonia. A failure to respond to antibiotics as expected is often the clue that signals doctors to look for an unusual cause, as in this case. It's time to see another patient. Doc, for the past few months, whenever I walk up the stairs in my house, I feel pressure in my chest. The pain has been getting worse lately, and sometimes I even feel pain in my jaw and my left shoulder. When it's really bad, I have to sit down for a while and the pain seems to go away. You have been transported into the patient's heart. To cure this patient, you need to find all of the cholesterol plaques in his arteries and eliminate them. Remember that he has been suffering from chest pain brought on by even mild exercise. You are the best doctor around. The patient's angina is gone since you cleared the cholesterol plaques from his arteries. Angina pectoris occurs when the oxygen supply to the heart muscle is inadequate to meet the heart's demands. The heart is deprived of oxygen, and the patient experiences pain. Most commonly, angina occurs with mild stress or exercise. Angina is caused by narrowing of the coronary arteries, usually due to a buildup of cholesterol plaques. The pain can be relieved with medication, but definitive treatment requires intervention to restore normal blood flow to the heart muscle. Coronary balloon angioplasty and coronary artery bypass grafting, or CABG, are the most common methods of definitive treatment. Congratulations! I've been feeling lousy for a while now. I've been losing weight, and sometimes I get fevers that come and go. I've also been coughing in the mornings. Before, nothing ever came up, but lately I've been coughing up thick green stuff. Sometimes I feel a bit out of breath. Please help me. You have been transported into the patient's brain. To cure this patient, you need to find the source of his infection and eliminate it. Remember that he has been complaining of fever and a productive cough that has lasted for more than a month. Fantastic! You have cured the patient of pulmonary tuberculosis. Tuberculosis, or TB, is a highly infectious illness caused by the bacterium Mycobacteria tuberculosis. The infection is passed from person to person through airborne droplets resulting from coughing or sneezing. Most typically, the lungs are affected, although TB can infect nearly any organ. In the vast majority of cases, the immune system is able to control the infection. Oftentimes, however, control is achieved through the formation of small walled-off nodules called granulomas. Inside the granulomas, there is still bacteria in a dormant state which can reactivate at a later stage in life. The patient in this case had a large right upper lobe cavity caused by reactivation of bacteria within a granuloma. The incidence of TB in the U.S. had been dropping for many years, but it has begun to rise again in recent years. This is attributed to the AIDS epidemic, which has created a large number of people with weakened immune systems who become infected and then serve to spread the disease. More worrisome, new TB strains are emerging that are resistant to all known forms of antibiotic therapy. Dum 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 dum.
The brain.
This photograph shows a human brain. It is dominated by the massive cerebrum with its many deep folds. Also seen in the photograph are the cerebellum, located at the back of the brain, and the brainstem. The brain and the spinal cord together form the central nervous system, or CNS. The CNS is the control center for the body. The lethal effects of rabies viruses result from infection of the CNS. Without proper function of the CNS, vital functions such as breathing and swallowing stop working. Shutdown of the CNS eventually leads to coma and death. The most reliable method for determining whether an animal is infected with the rabies virus is to examine an actual brain specimen for the presence of rabies viruses.
Neuron.
The basic function of the nervous system is to transmit messages from one place to another. The nerve cells which do this job are called neurons. Each neuron has a single long branch called an axon, which permits messages to be carried to distant parts of the body. This illustration shows a single neuron with its axon in yellow extending off to the left. Normally, neurons perform their functions by conducting electrical signals down the length of their axons. Unfortunately, these same axons serve as the pathway by which rabies viruses migrate from the site of an animal bite to the central nervous system. The further away the animal bite is from the central nervous system, the longer it takes for the disease to develop.
Antibodies.
This picture shows several Y-shaped antibody molecules within a blood vessel. Antibodies are made by the immune system to react with specific foreign invaders, such as rabies viruses. Treatment for people exposed to rabies involves administering preformed anti-rabies antibodies obtained from horses. These antibodies bind to the rabies viruses and help the body to eliminate them before they can do any harm. Next, the patient is immunized with killed rabies viruses. These viruses stimulate the patient's immune system to make its own anti-rabies antibodies. Treatment is essentially 100% successful at preventing the disease when it is given within a few days of exposure to rabies. Of historical interest, it was Louis Pasteur who first explained the cause of rabies. He also developed a method of immunization to prevent the disease from occurring. In the 1800s, this was a monumental achievement.
Rabies virus.
This is a picture of a rabies virus. The rabies virus is a member of a family of rhabdoviruses. Infection with the rabies virus causes a serious illness that primarily affects animals, though people can also contract the illness if they are bitten by a rabid animal. Common animal carriers include foxes, skunks, raccoons, bats, and dogs. The disease usually begins 2 to 8 weeks after exposure to the virus. Early symptoms include loss of appetite, intense thirst, nausea, vomiting, and fever. The virus causes its ill effects by damaging the central nervous system. It is generally only a few weeks from the onset of symptoms until the patient lapses into a coma and dies. Untreated rabies is nearly universally fatal. Fortunately, treatment can prevent rabies from developing if it is initiated soon after the patient is bitten by the rabid animal. Dum 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 dum.
Endoscopy.
The photograph at left shows the inside of a normal duodenum as seen through an endoscope. An endoscope is a flexible tube with both a light and a camera lens at its end. Doctors often use the endoscope to examine the digestive tract when a patient develops vomiting or diarrhea that doesn't resolve as expected. Tiny surgical tools can be also manipulated through the endoscope, allowing treatment of a wide variety of digestive system disorders.
Microvilli.
The photograph at left shows a close-up of a mucosal cell which lines the inside of the small intestine. Each of the tiny finger-like projections on this cell's surface are called microvilli. If we were further away, we could see that the inner lining of the small intestine is itself organized into many small finger-like projections called villi. The villi and microvilli together create a surface area within the small intestine that is as large as a tennis court. The main purpose of this lining is to promote the effective absorption of food. This is a job it is quite well designed to perform.
The small intestine.
The illustration at left depicts a segment of the small intestine. The small intestine is a long tube, about 21 feet or 6.5 meters, whose purpose is to absorb food. The inner layer of the small intestine, or the mucosa, is very well suited for this job. It is organized into innumerable little finger-like projections called villi. The mucosal cells which line the villi are in turn covered with even smaller finger-like projections called microvilli. The villi and microvilli greatly increase the surface area with which to absorb food. It is the mucosal cells which line the villi that are most damaged by a rotavirus infection. This disrupts the absorption of food and causes vomiting and diarrhea. The middle walls of the small intestine contain circular and longitudinal smooth muscle layers. Under normal circumstances, these muscle layers contract in rhythmic fashion to force the partially digested food along the whole length of the small intestine. This contraction process is called peristalsis. The outermost layer of the small intestine is called the serosa.
Rotavirus.
The illustration at left shows a single rotavirus. Worldwide, it is one of the most common viruses that can infect the digestive system and cause gastroenteritis. The rotavirus is easily spread from person to person in a family or other group setting. Rotaviruses are also found in a number of animal species. Rotavirus infection is particularly problematic in infants and young children, and it is responsible for many deaths in undeveloped countries where medical care is inadequate. The rotavirus causes illness by invading the lining of the duodenum and the upper small intestine. The intestinal villi are transiently damaged, but they rapidly regenerate their lining. Illness typically begins with 1 or 2 episodes of vomiting followed by diarrhea. Uncomplicated cases resolve in about 1 week. Treatment requires only rest and adequate fluid intake to prevent dehydration. Dum 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 dum.
Coronary artery disease.
Atherosclerosis is a disease which results in narrowed arteries and decreased blood flow. The arteries become narrowed because of a buildup of plaques within their inner walls. This illustration shows a yellow plaque within the inner layer of an artery. Plaques consists of a mixture of substances including cholesterol, fat, fibrous tissue, clumps of platelets, and sometimes calcium. Atherosclerosis begins early in life, but generally causes no symptoms until middle or old age. Only after an artery becomes very narrowed will blood flow be diminished enough to cause symptoms. When atherosclerosis affects the coronary arteries, it is called coronary artery disease, or CAD. Patients with CAD experience chest pain when the blood supply to the heart is inadequate to meet the demand for oxygen. This pain is called angina. CAD is a very common ailment with characteristic symptoms. Angina typically occurs after a predictable amount of exercise, for example, walking up one flight of stairs, and is relieved by rest. Medication, or TNG, is available that relieves the pain by briefly dilating the coronary arteries, but this has no effect on the underlying disease. Patients with angina are at high risk for having a heart attack if their coronary artery disease is not treated.
The heart.
Although the heart is constantly pumping blood, it does not actually receive any oxygen from the blood which travels through its chambers. Instead, the heart receives all of its oxygen from the arteries which encircle it. These blood vessels are known as the coronary arteries. This illustration shows the heart and the coronary arteries. Under normal circumstances, the coronary arteries have significant reserve capacity, and they can easily meet the oxygen demands of the heart muscle. Problems with supplying the heart muscle with oxygen arise only when the coronary arteries become narrowed due to atherosclerosis.
Coronary angiography.
It is often desirable to study the coronary arteries of patients with coronary artery disease, or CAD. Many different tests have been devised to do this. At present, the definitive test for evaluating the coronary arteries is angiography. Coronary angiography is an invasive test that requires placing a catheter in the coronary arteries. Dye is then injected, and detailed pictures of the coronary arteries are obtained. This test enables doctors to determine the exact location and severity of the plaques within the coronary arteries. The photograph at left shows a doctor performing a coronary angiogram. Several new forms of treatment for CAD have emerged in recent years. The most well accepted is coronary angioplasty. Coronary angioplasty involves positioning a small balloon catheter in a coronary artery such that the balloon crosses a plaque. The balloon is then inflated to compress the fatty plaque and make it smaller. When the balloon is deflated, the plaque usually remains compressed. This increases the size of the arterial lumen or central opening and improves blood flow to the heart.
Heart attack.
People with coronary artery disease are at high risk for having a heart attack. A heart attack occurs when the blood supply to a part of the heart is suddenly cut off and the affected heart muscle dies. The usual cause of a heart attack is the formation of a blood clot at the site of an atherosclerotic plaque. The clot completely blocks the artery, cutting off blood flow beyond it. The medical term for a heart attack is myocardial infarction. A heart attack causes changes in the normal pattern of the EKG tracing, as shown in the illustration at left. Heart attacks are the #1 cause of death in Western societies. The risk factors for having a heart attack are well known. These risk factors include a diet high in fat and cholesterol, smoking, obesity, inactivity, high blood pressure, diabetes, and a family history of heart attacks. Fortunately, most of these risk factors are related to lifestyle. It is thus possible for a person to lower the risk of a heart attack if they choose to. Dum 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 dum.
The lungs.
The lungs are a vital organ which enables the body to obtain oxygen from the air we breathe and to eliminate carbon dioxide. The structure of the lungs can be likened to a branching tree. Starting with the trachea, or windpipe, the respiratory tree branches initially to form two main bronchi, or airways, that enter the right and left lungs. The main bronchi then branch again and again, first forming smaller bronchi, and then even smaller bronchioles. At the end of the smallest bronchioles, there are tiny grape-like air sacs called alveoli. It is in the alveoli that oxygen comes into contact with the red blood cells that will carry it to all parts of the body. In the rare cases when influenza goes on to cause pneumonia, the alveoli tend to fill up with water and cellular debris. This prevents the red blood cells from picking up oxygen and causes hypoxia. Hypoxia simply means low oxygen. This is the main problem for patients with pneumonia.
The respiratory lining.
The photograph at left shows a portion of the lining of the upper respiratory tree. The lining consists of two main types of cells, goblet cells and ciliated cells. The goblet cells secrete a sticky mucus which coats the respiratory lining and traps foreign particles. The ciliated cells, shown in orange, have numerous tiny hairs, or cilia, on their surfaces, which continuously beat in unison. This action sweeps the sticky mucus with its trapped particles up and out of the lungs. Influenza viruses invade and ultimately destroy large numbers of the cells which line the respiratory tree. This, of course, impairs the function of the lining and causes people with influenza to cough. It also makes people more susceptible to other infections, since they are less able to sweep out other potential invaders. Of note, cigarette smoking is also very toxic to the cells of the respiratory lining. This accounts for the chronic coughing and increased susceptibility to upper respiratory infections seen in smokers.
Influenza virus.
There are three main types of influenza viruses, named types A, B, and C. The schematic illustration at left shows a single influenza virus. Among the most notable features are the little spikes, shown in white, that stick out from the viral surface. The exact nature of the spikes, or glycoproteins, determines the type of the influenza virus. Immunity to influenza occurs when the immune system makes antibodies that bind to these glycoprotein surface spikes. Unfortunately, the type A and, to a lesser extent, type B influenza viruses are unstable, with new versions appearing every year. When a new version appears, the antibodies still circulating in the body from the last bout of influenza will be less effective at eliminating the virus, and the person may get ill once again. Occasionally, an influenza virus will appear that is so radically new that virtually no one is immune to it. When this occurs, the result is a worldwide flu outbreak called a pandemic.
Influenza virus.
The photograph at left shows a single influenza virus. Influenza viruses are responsible for the respiratory illness popularly named the flu. This illness is spread from person to person through the air by virus-infected water droplets that are sneezed or coughed up. Influenza generally occurs in local outbreaks. Outbreaks tend to occur in the winter months, spreading rapidly through places where many people congregate, such as schools, offices, and nursing homes. The typical case of influenza is characterized by fever, muscle aches, headache, loss of appetite, cough, and a runny nose. The illness typically resolves within a week and does not require any treatment beyond rest and fluids. Rarely, influenza will progress and infect the lungs themselves, causing a severe pneumonia that can be fatal even in young, healthy adults. Most deaths from influenza, however, occur in old people who develop bacterial pneumonia because the viral infection lowers their resistance to other infections. Thanks, guys. Peace and love. Unable to commence procedure. Please interview the patient first. The history and physical exam are still the most important parts of the diagnostic process. In general, lab tests and x-rays are both only means to confirm or refute a diagnosis made on the basis of the history and physical. It is unacceptable to jump into the virtual medical unit without first interviewing the patient. You should also click on the Diagnostic Information Console to learn more about the patient. You have already cured this patient. You should go on to the next patient while there is still time. Oh no! You zapped a nerve cell! The nervous system contains many billions of neurons, or nerve cells. However, neurons do not grow back after they die. A baby starts its life with all the neurons it will ever have. Many neurons may be damaged by a serious infection. Fortunately, people are born with a great excess of neurons. Oh no! You zapped a lung cell! The trachea and bronchi are lined with cells that have tiny hairs, or cilia, on their surface. These hairs continually move back and forth in a sweeping motion to help eliminate foreign material from the lungs. Respiratory tract infections of any type damage these cells and make it more difficult to clear fluid and pus from the airways. Viral pneumonia typically involves both lungs, while bacterial pneumonia frequently involves only a single lung. Oh no! You zapped a red blood cell! Red blood cells make up about 40% of the blood volume. When doctors measure this number, it is called the hematocrit. Sometimes the number of red cells in the blood goes down, either because too few cells are being made or because they are being destroyed prematurely. This is called anemia. Under normal circumstances, a red cell stays in circulation for about 120 days before it is removed from the blood by the spleen. Oh no! You zapped an intestinal cell! The lining of the small intestine is designed to absorb food particles. This lining is covered with many small finger-like projections called villi. The villi are in turn covered with cells whose surfaces have many tiny finger-like projections called microvilli. These intestinal lining cells normally have a short lifespan of only 4 to 7 days. This is shortened even further by an infection which may severely damage the intestinal lining. Oh no! The patient is now in critical condition. This procedure has been terminated. Stand by for unit reset. Please attempt the procedure again immediately.